A big part of that will be children and parents being able to find their own information. I think that's part of this time, so I think it's good to research how the children and the parents can help themselves as well.
I think on the longer run it will be more for parents and patients who have problems to be able to see if they eat the wrong things or take too much or not enough prion, so it can help them to improve their nutrition and their prion intake. Or maybe for parents with small children who need to still learn about the amount of prion that they need to give to their children.
The education part, of course, is wonderful. The fact that we include younger children, I think the whole family thing is really interesting. I think it's a fun way of introducing younger children and families to participating in research, because they will be asked to participate in research more clinically or medically related. And then they have already gotten used to it. There's certain steps and there's certain things, and you do it during your outpatient clinic, and you know the dietitian may well ask you to fill in questionnaires and all that. So there's several parts that you know, it's not only about the project, but it's also integrating e-health, electronic health, you know, using apps in healthcare, which is a very important part of this project.